everyone, welcome to TryRide. This is Pack 65, myself Srija. So today in this session you're going to learn about the modifiers used in CPT coding. So 66 modifier, surgical team. So what does it mean? Modifier 66 is used when a very complex surgery requires a team of many doctors, often from different specialties, and specially trained staff working together at the same time. So the surgery was so complex that a whole team of doctors was needed. So when to use modifier 66? Surgery is highly complex. It requires multiple physicians, not just one or two. So doctors may be from different specialties, special equipment and skilled personnel are involved. So each participating physician reports the code with modifier 66. So easy examples are heart transplant surgery, involves cardiac surgeon, vascular surgeon, anesthesiology team, and perfusion specialist, etc. So each physician builds procedure CPT code as well as modifier 66. So you should not confuse with modifier 62 as well as 66. So 62 is for only two primary surgeons, whereas 66 is for large surgical team. So next is modifier 76, repeat procedure or service by same physician or other qualified healthcare professional. So what does it mean? So modifier 76 is used when the same doctor repeats the same procedure on the same patient after the first one. So the same doctor did the same procedure again. So when to use modifier 76? When there is a same procedure done by same physician on the same patient, it is repeated after the initial service and this is not used for E&M services. For example, a doctor performs a chest x-ray in the morning, so the same doctor repeats a chest x-ray in the evening. So the second claim is chest x-ray CPT code plus modifier 76. Modifier 77. Repeat procedure by another physician or other qualified healthcare professional. So what does it mean? So modifier 77 is used when a procedure is repeated by a different doctor, not the one who did it first. So another doctor repeated the same procedure. So when to use modifier 77? Same procedure, same patient, different physician, repeated after the original service and not used for E&M services. For example, if a doctor A performs an ECG, so later doctor B repeats the ECG. So doctor B builds ECG CPT report plus modifier 77. Modifier 78. Unplanned return to operating or procedure room when same physician and related procedure during the post-operative period. So after surgery, sometimes the patient has a problem or complication. So because of this, the same doctor must take the patient back to the operating or procedure room for a related procedure. So this was not planned earlier. Same doctor, unplanned surgery again related to the first surgery. So when to use modifier 78? During the post-operative period. Same physician, unplanned procedure, procedure is related to the original surgery and it requires operating or procedure room. For example, patient had a gallbladder surgery. So later he develops internal bleeding and same surgeon takes patient back to operating room to control the bleeding. So in this case, you have to assign second procedure CPT code plus modifier 78. So modifier 78 does not start a new global period. So this is not a repeat of the same procedure. If it is repeated, you have to use modifier 78. Then 79. 79 is about unrelated procedure or service by the same physician during the post-operative period. So what does it mean? During the recovery period of one surgery, the same doctor performs another procedure, but it is completely unrelated to the first surgery. So to show it is unrelated, we have to use modifier 79. So you have to use modifier 79 during post-operative period when same physician is done. Procedure is unrelated to the original surgery and usually starts a new global period. Example, patient had hernia repair. So during recovery, same surgeon removes a skin cyst. So how you have to code? Skin cyst CPT code plus modifier 79. So next is modify 80. It denotes assistant surgeon. So when a second surgeon helps the main surgeon during an operation, the helping surgeon is called as an assistant surgeon. To show this help, we have to add modifier 80. So when to use modifier 80? When it is a major or complex surgery, when assistant surgeon actively helps and not just observing. Example, main surgeon performs heart surgery, so another surgeon assists throughout the procedure. So in this case, you have to assign surgery CPT code plus modifier 80. Modifier 81, minimum assistant surgeon. Sometimes the assistant surgeon helps only for a short time or he does only minimal work but not throughout the entire surgery. So then we have to use modifier 81. So assistant surgeon helped a little. It means, so for example, assistant helps only during the closure of surgery but not involved in entire procedure. So in this case, you have to assign surgery CPT code plus modify 81. Modify 82. Assistant surgeon when qualified resident surgeon not available. So what does it really mean? In teaching hospitals, resident doctors usually assist. So but if no qualified resident is available, another surgeon assists instead. So to explain this situation, you have to use modifier 82. So when to use modifier 82 in the teaching hospital? When no qualified resident available and another surgeon exists or assist. Easy example is resident surgeon is unavailable, attending surgeon assists main surgeon. So in this case, you have to assign surgery CPT code plus modifier 82. So modifier 82 is only for resident unavailable cases. Modifier 90, reference outside the laboratory. So sometimes a doctor orders a lab test, but the test is done at an outside laboratory, not in the doctor's own facility. So to show this condition, you have to use modifier 90. Example, doctor orders biopsy test, sample sent to external lab. So outside lab performs test and sends the report. So in this case, you have to assign modifier 90. Modifier 91, repeat clinical diagnostic laboratory test. So what is modifier 91? Modifier 91, it is used when the same lab test is done more than once on the same patient on the same day because the doctor needs new results to monitor the patient's condition. So it tells that this test was repeated for medical reasons but not by the mistake. So why is modifier 91 needed? So sometimes a patient's condition changes quickly. So the doctor needs multiple readings to see improvement, worsening and response to the treatment. So when to use modifier 91? When the same lab test is repeated on the same day for the same patient to get additional and new results. For example, a patient in ICU has potassium levels checked in the morning. So doctor adjusts the treatment and potassium is checked again in the evening. So second test is built with modifier 91. So when not to use modifier 91? So do not use modifier 91 if the test is repeated to confirm an initial result due to equipment or specimen problems because of lab error and when only one final reportable result is needed. So also do not use modifier 91 if the CPT code already includes the multiple results. For example, glucose tolerance test, suppression or stimulation test. Modifier 92, alternative laboratory platform testing. So what is modifier 92? So this is used when a lab test is done using a portable single-use disposable testing device. So instead of a regular laboratory machine. So why is this modifier 92 used? It shows the test was performed using a test kit, a handheld or transportable device, a single-use analytical chamber. And this is more common in emergency settings, clinics, and outreach or screening programs. So when to use modifier 92? So you have to use modifier 92 when testing is done using a portable or disposable platform. So the CPT code remains the same. So only the testing method is different. For example, HIV testing done using a rapid test kit. Instead of a full lab analyzer, you have to report the CPT code with modifier 92. So when not to use modifier 92? When the test is not done using standard lab equipment. The CPT code already describes the testing method. So modifier 92 is for same test and different testing method. What is modifier 93? Synchronous telemedicine service rendered via telephone or other real-time interactive audio only telecommunication system. So modified 93 is used when a telemedicine visit is done in real time using only audio, such as telephone call. So there is no video in this modifier. There is only audio, only voice communication. So what do you mean by the word synchronous? So synchronous means doctor and patient talk live. So interaction happens at the same time, similar to a face-to-face visit but through a phone. And what are the key conditions for Modify 93? Real-time audio-only communication. So patient and provider are in different locations. The discussion must be medically sufficient, history, assessment, decision-making like an in-person visit. For example, patient calls doctor for follow-up of blood pressure. So doctor asks question, reviews symptoms and adjusts the medication. So visit is done only on phone but there is no video. So you have to report the CPT code with modifier 93. So same as 93, 95, but in 95 we have both audio and video services. So modify 95 is used when a telemedicine service is provided using real-time audio and video such as video call and telehealth platform like Zoom or hospital telemedicine system. So what makes it different? So doctor can see and hear the patient. It is closest to a face-to-face visit and this is used widely for general consultations, mental health visits and follow-ups. So what are the key conditions for Modify 95? Real-time interaction, audio plus video both must be used and patient and provider are at different locations. Service meets all components of an in-person visit. So do not use Modify 95 when only audio is used. You have to use 93 instead. And when the interaction is not live, maybe emails or recorded videos, you should not use 95 modifier. So for a telemedicine visit to be billed, the communication between doctor and patient must be as complete as a normal face-to-face visit. So this discussion should cover patient history, symptoms, assessment and medical decision making. So if it's too short or incomplete, it cannot be billed as a full visit. So a video visit must be medically meaningful but not just a quick chat. Appendix P. So what is Appendix P? It is a special list in a CPT book that shows which CPT codes are normally face-to-face, but they are allowed to be done through telemedicine. So what is the rule for Modify 95? Modify 95 can be used only with CPT codes listed in the Appendix B. Appendix P. So if the code is not in Appendix P, you cannot use Modify 95. Modify 96 Habilitative Services. So Modify 96 it is used to show that the service was provided for habilitation but not for rehabilitation. So habilitation means learning a skill for the first time. Rehabilitation means relearning a skill that was lost. So what are habilitative services? So habilitative services help a person to learn new skills they never had before, to develop daily living abilities, to maintain or improve those newly learned skills. So these are often used for children with developmental delays and also autism spectrum disorders as well as congenital conditions. So examples of Modifier 96. Speech therapy for a child who has never spoken. Occupational therapy to teach a child how to hold a spoon. Physical therapy to help a child learn to walk. And build the therapy CPT code with Modifier 96. So what is Modifier 97? Rehabilitative services. So this is used when a service is provided for rehabilitation purposes. So rehabilitation means getting back skills that were lost due to illness, injury or disability. So Modifier 97 means regaining of the lost abilities. So when to use Modifier 97? So you have to use Modifier 97 when the service can be either habilitative or rehabilitative. So but it is given to restore the lost function. So the patient had a skill before and lost it later. So in these cases, you have to assign modifier 97. And what are the examples of rehabilitative services? Physical therapy after a fracture or surgery, speech therapy after a stroke, occupational therapy after an accident. So you have to report the therapy CPT code as well as with modifier 97. So next is modifier 99. Multiple modifiers. So what is modifier 99? So it is used when two or more modifiers are required to correctly describe a single procedure. So when to use modifier 99? You have to use modifier 99 when a procedure needs multiple modifiers to fully explain how the service was performed. For example, a procedure is performed on the left side, LT. So it is done by an assistant surgeon. You have to assign modifier AS. So you have to, what is the code format here? You have to give CPT code plus modifier 99, as there are two modifiers involved in this. So do not list all the modifiers without 99 if the payer requires it. So always check the payer guidelines. So this is all about the modifiers which are used in CPT. And next, coming to anesthesia physical status modifiers. So what are called as physical status modifiers? So they are used in anesthesia coding to show how healthy or sick a patient is before anesthesia is given. So they are based upon the American Society of Anesthesiologists ASA classification. So these modifiers, they help to indicate the patient risk as well as the complexity of the anesthesia care. So where are these modifiers used? So these are used only with anesthesia CPT codes. So anesthesia CPT code ranges are from 00100 to 01999. So the physical status modifier is always appended to the anesthesia code. For example, 00100 P1, that means anesthesia for a healthy patient. 00100 P453 means it's a very sick patient plus discontinued procedure. So physical status modifiers are very much important while assigning the codes for anesthesia. Here is physical status modifier P1, which indicates normal healthy patient. That means there are no medical problems over here. He is an healthy individual, and example, young patient with no illness undergoing minor surgery. So you have to assign the code P1. Next, physical status modifier P2, patient with mild systemic disease. So there will be a mild medical condition and the condition is controlled. For example, controlled diabetes. Physical status modifier P3, a patient with severe systemic disease. So there is a serious disease that affects the daily life, but it is not life-threatening all the time. Example, uncontrolled diabetes, severe COPD and heart disease. P4, a patient with severe systemic disease that is a constant threat to life. So it is a very serious condition and the person's life is in danger. For example, advanced heart failure, severe trauma and sepsis. So always remember, every anesthesia code must have a physical status modifier. So more than one modifier can be used if required. So physical status modifier does not replace other modifiers. So why are these modifiers important? Because they reflect the patient risk level, they affect the reimbursement, and they are important for CPC as well as anesthesia coding exams. Physical status modifier P5, a morbid patient who is not expected to survive without the operation. So simply it means the patient is extremely critical. Surgery is the only chance to survive. So what are the key points? The life-threatening condition. Surgery is done as a last effort. Very high anesthesia risk. So examples like massive internal bleeding after trauma, ruptured abdominal aortic aneurysm and severe septic shock. Next is physical status modifier P6. So a declared brain dead patient whose organs are being removed for donation. That means the patient is legally dead and anesthesia is given only to preserve the organs. So modifier P6 is used only for the organ donation, patient is brain dead and not used for routine surgery. So this is about the anesthesia physical state modifiers. And there are category 2 modifiers, category 2 CPT modifiers. So these are used along with the category 2 CPT codes, the codes which track the quality of care but not the payment. So they show that a service was considered but not performed due to a valid reason. So there is a reason the service may not be done. It might be a medical reason, a patient reason, a system reason. So all the reasons must be documented in the medical record. So now why are these category 2 modifiers used? For quality reporting, for performance measures, they act as denominator exclusions. So category 2 modifiers, they are used only with category 2 CPT codes. So what does this mean? So category 2 modifiers should be used only when CPT guidelines specifically allow them. So you have to always check the category 2 guidelines, reporting instructions, parenthetical notes, code descriptions, and these are found in category 2 code list as well as alphabetical clinical topics listing. So you have to use category 2 modifiers only when the CPT books tells you to do. And category 2 modifiers are 1P, 2P, 3P. So 1P, performance measure exclusion modifier due to medical reasons. So modifier 1P, it is used when a recommended service was not done because of a medical reason. So what will be the common medical reasons? Which are not indicated, organ or limb is absent, service already done earlier and not medically needed. So the reasons which are contraindicated, patient has allergy, risk of drug interaction and medical condition makes it unsafe, and other medical reasons condition. So any valid medical reason documented by the provider. So a patient should receive a vaccine but has a severe allergy. So you have to use category 2 code plus modifier 1P. Next is modifier 2P, the patient reason exclusion. What is modifier 2P? It is used when a service was not done because of the patient decision or situation. So patient related reasons might be patient refuse the services, economic reasons can't afford the surgery, and social reasons and also religious beliefs, and sometimes other patient related causes. So doctor documents the screening, patient declines due to personal belief. So you have to use category 2 code plus modifier 2P. So then is modifier 3P, system reason exclusion. So what is modifier 3P? It is used when a service was not done because of a system issue, but not the doctor or the patient. So system related reasons are equipment not available, test kits shortage, power failure, and staff unavailable. Here is an example. There is a lab test recommended and machine was out of order. So in these cases, you have to use category 2 code plus modifier 3P. So resources which are not available, it includes equipment not available, test kit out of stock, and no trained staff. So insurance and payer limitations. So insurance does not cover the service, authorization denied, and there are coverage restrictions. So in these cases, you should not assign 3P. Next is modify 8P. The action is not performed, reason not specified. So what is modify 8P? So it's a reporting modifier which is used when a required quality action was not performed and the reason is not documented or not specified. So what is the simple explanation? The service was not done, but we don't know why. Example, quality measure requires blood pressure check. So there is no documentation of why it was done. So you have to use category 2 code plus modifier 8P. And what is the important rule regarding 8P? So you have to use 8P only when the reason does not fit into 1P medical, 2P patient and 3P system. So this is about the reasons of category 2 CPT codes, category 2 CPT modifiers. So this is about today's session. I hope this session has helped you. So in the next session, you're going to learn about the instructions how to use a CPT code. Thank you.